Good evening, everyone, and welcome. It's wonderful having you join us this evening. I'm Eleanor Hayes, Director of Communications for the Division of HR at Cleveland Clinic. And it's great that you have tuned in this evening for our event, which is called, Can the Langston Hughes Community Health and Education Center Be Your Home for Healthcare? Tonight, we have a great panel of speakers who are going to give you new insight into what Langston Hughes is all about now, the future of what's on East 79th Street and how it's evolved and how it can very well be your choice for primary care in the future. This meeting will be recorded and it will be available on demand within just a few days. The session will be open for a Q&A period also because we want to hear from you. We thank those of you who have already sent in some questions for our expert panelists. Now, as we go along, we want you to go into the Q&A box and enter your questions there. That's where we will be reviewing them, reading them, and making sure that we answer as many as possible. And thank you again for those of you who sent some questions in advance. Okay, now enough of the housekeeping. Let's get right to introducing our panel for this evening. Our guests include Chantel Wilcox, Community Health and Partnerships Director, East Region, Dr. Colin Killeen, Shauna Chesney, Family Nurse Practitioner, Pediatrician, Dr. Rupa Thakur, and Angela Kane, Community Health and Partnerships Director for the Central Region. We welcome all of our panelists who have joined us tonight. Now, as many of you know, for the last several years, the Cleveland Clinic Langston Hughes Center has been a staple in the Fairfax community, offering services such as exercise facilities, free health screenings, health challenges, educational talks, even food and personal care item distribution. So it's with great pleasure that now we announce that we are adding adult primary care services to that list. Our desire is to bring world-class care outside the walls of the hospital and right into the community, directly for the benefit of the residents of Fairfax, Hough, and the surrounding communities. And that is for the benefit of everyone's well-being. So to learn more about the primary care services that are provided at Langston Hughes, we're going to turn to our panel. We're going to begin with Chantel Wilcox, who's going to talk to us about the future of Langston Hughes, the plans for the wraparound services. Let us know about Langston Hughes as a COVID-19 vaccination site, and also introduce us to our new leadership team there. Chantel.
Thank you, Eleanor. So for those who don't know me, I'm Chantel Wilcox, and Langston Hughes is a community health and education center where we promote health and wellness. You know, he has expanded its services beyond health and health education and physical activity, and now to provide primary care services, accompanied by social work, financial counseling, patient navigation, and mammography services. Our goal as we move forward is to package our primary care services to include wraparound services that will address social determinants such as food, housing, transportation, employment, safety, etc. This will allow our patients to be, provided a well-rounded experience that will not only improve their health outcomes, but also improve their health and social well-being. We have a vision of having a teaching kitchen in the future that will educate the community on healthier ways to prepare foods, even perhaps a community garden and educate on how to actually teach cooking straight from the garden into the kitchen. We look to host small groups of people, where that share common chronic illnesses and to serve as a support to one another throughout their journey to wellness. We want the community to feel a part of their care. And the most thing we want to do is encourage self-efficacy to improve trust and also relationship building. So we're excited, to make the community a part of their healthcare. Additionally, we're offering COVID vaccines at Langston every Monday from 7:30 to 4. And we're providing 225 screenings a day. We're excited about the partnerships and all of the promotion that we got, including our partnerships. We're encouraging everyone to call. And if you have issues with being able to schedule online, there's a telephone number that can be provided, and we'll make sure that that is provided to you before we leave today. And for more information on the requirements and which groups are permitted to register at this time, there's a website that'll be offered. But now I just wanted to share that we do have a new clinical team on site. We have Dr. Colin Killeen. We're excited to have him there. We have Shauna Chesney. But more than that, I really would like to make sure that I introduce my colleague, Angela Kane, who is now the Director for Central Region and Youth Strategies, along with her dyad partner, Dr. Rupa Thakur.
Thank you very much, Chantel, for giving us that overview. It's very helpful as we learn about the future of Langston Hughes. You know, if you've grown up in Cleveland and driven through the Fairfax neighborhood, Langston Hughes is clearly not only a historic building, former library, and a central part of that Fairfax area, but it's something that the community has worked to hold on to and has appreciated that Cleveland Clinic has come in and done so much right there at Langston Hughes. Dr. Killeen, Medical Director, we'd love to hear from you about how you and your team are going to serve the community and all that Langston Hughes has in the future for us there.
Sure. Thank you so much, Eleanor. Thank you, Chantel. Super excited to be here. I wish that I could see people in person, and I can't wait to in the near future. Just a little bit of background on myself. I am an internal medicine physician. I practice here at the clinic for the last almost 5 years. I'm from Michigan and have really worked my last 10 years in practice solely in primary care, taking care of patients who are complex, but also working on the preventative side for comprehensive care. My interests have really been focused the last couple of years on public health and prevention, as well as underserved communities. And I think it lends itself well to the model that we have at Langston, which is the patient-centered medical home. And you'll hear a lot of that. You'll see some on the website for Langston as well. And what the patient-centered medical home, it's a care delivery model where the patient treatment is coordinated through the primary care team, whether it's the physician or the mid-level nurse practitioner or PA, to really ensure that patients receive the necessary care, essentially when and where they need it. And really the most important in a manner that they can really understand. And the objective is to have sort of this centralized setting in the office that facilitates the partnership between the patient as well as the physician, but also the patient's family, because there's a lot that happens in these visits, especially with complex care and complex medical issues. And so bringing family is certainly important into that. The part that I think that we're trying to use most is using some registries and the electronic medical record, which we have throughout our whole system, and using information technology to help people get healthier in addition, and to help the different care teams talk amongst each other to help patients achieve their best care. And I think really the big thing to understand with primary care, sort of what we cover, I think of it in the sense of an umbrella, and primary care sort of sits up at the top and coordinates things. We have specific training for comprehensive and continued care with patients from late adolescence all the way until the 100 plus. And the care really encompasses diagnosing common and uncommon conditions and helps with the continued management that's not necessarily problem oriented, but more patient oriented, and takes into account the whole patient. I guess lastly, I would say that my hopes for Langston are that not only is it a site where people get care, but that it continues on with the health improvements from a community aspect, because we know that communities thrive when people are healthy and they can go out and work, and mobilizing not only the healthcare teams that we have, but also the community outreach team that will be situated at Langston, in order to help sort of coordinate things between the medical education aspect, from the anchor institutions that will help us partner and to help people achieve things outside of just in the office, in the room with the patient. And I think that the idea is that we're trying to keep people healthy, but we can treat them when they're not. And I look forward to seeing lots of people in the clinic for when things start to get rolling and this pandemic starts to slow down.
Thank you, Dr. Colleen. Yes, we certainly look forward to seeing our primary care providers in person more and more in the future. You mentioned thrive, and that is such a very, very important word, because we know the connection between a healthy body, healthy individual, healthy family, good employment, and how it leads to a healthy community. And that's all about how we reach the point of thriving together. Shauna Chesney is a nurse practitioner, and I'm going to start by asking her, because Dr. Colleen mentioned primary care providers who might come to you in the face of a physician or a physician assistant or a nurse practitioner. So Shauna, thank you for joining us today.
Thank you for having me.
And how can you tell us how you as a nurse practitioner will be preparing for patients to come in for primary care?
Thank you. Thank you for having me. Yes, I will be one of the nurse practitioners at Langston Hughes providing primary care. My focus at Langston Hughes will be on health promotion, health maintenance, disease prevention, education, and counseling for the patients, as well as the diagnosis and management of acute and chronic diseases. So it is a great pleasure to be a part of the team here at Langston Hughes, and I'm looking forward to building and growing with all of you as well as the community.
And you mentioned counseling, you mentioned diagnostics, because
Yes.
It's more than just someone coming in and saying they have a particular issue or ailment. It's really about the whole person being seen
Yes.
by the provider, correct?
Yes, yes, it is. The whole person. So we're treating not just one thing, we're treating the whole person. That's the idea.
Very good. Thank you very much.
You're welcome.
Dr. Thakur, I'd like to ask you to tell us more about school-based health and how it's an asset to the community.
Absolutely. So school-based health is near and dear to my heart. This is what I've spent a lot of my time on the past few years, is kind of getting our program to expand from what it was a few years ago. So many of you may be familiar with Dr. Jocelyn Elder. She's a former US Surgeon General and a pediatrician. And one of her famous quotes is that you cannot educate a child who's not healthy, and you cannot keep a child healthy who's not educated. So really kind of mirroring what Dr. Colleen has already said, our mission is really to bring primary care to your child. If you can't take off work, you don't want to take your child out of school to bring them into their medical home, that's fine. We will come to your child at the school where they're at and provide those same services there. So what are the services that we provide? We do yearly physicals or sports physicals, same thing. We'll give your child vaccinations, immunizations. We'll do all of their routine age-appropriate screenings. We can see them for sick visits, a cold, sore throat, belly pain, any of those types of things. We can see them for minor injuries, for chronic condition follow-ups. So those children who might have ADHD, asthma, maybe even mild, moderate depression or anxiety, we can do follow-ups for them. And we're actually building out our mental health access. So we have a psychologist who has joined our mobile unit team. and he is doing both virtual and will be soon, when some of the pandemic restrictions lift, we'll be doing visits on the mobile unit as well. And we're also kind of building out our subspecialist access. So during the pandemic, of course, a lot of our subspecialists have become very comfortable doing virtual visits or distance health visits. And so we're hoping to connect a lot of our students / patients who we see on the mobile unit to our subspecialists using that platform. So it's a very exciting program. And I hope that if you have the chance, you see the mobile unit in your community, that you'll, maybe take a quick tour or something like that. If it's safe to do so, we would welcome you.
Thank you, Dr. Thakur. And as you mentioned, the mobile unit, we'll be getting to questions a little bit later, of course, from the audience, but I can't help but asking you now, where is the mobile unit currently traveling? What schools or what school districts?
Sure. So our current districts, CMSD is our most recent addition. We started there in January of 2020. We also go to East Cleveland, Maple Heights, Warrensville Heights, Lakewood, and we're in talks with several of those districts around converting to an in-school model. As they're renovating their spaces, they're actually thinking of developing little clinics inside of their schools. And so we're happy to be present in that capacity as well.
Very good. Thank you very much for sharing that. Clearly, what you are saying points to how what's going on at Langston Hughes is more than what you see in the building when you come in as a patient or as a visitor, perhaps accompanying a family member or a loved one there for care. There is a lot going on in the community within Fairfax, within Hough, and in other areas of Greater Cleveland. Angela Kane, partnerships are something that we've clearly just heard about, because it certainly takes strong partnerships when we talk about working with our school district. So that's a part of the name when we talk about what you do in community and health partnerships. And so when we think of Langston Hughes as a community and health education center, can you tell us about youth education and the workforce initiatives, as well as how the community can get to know more about what you're doing at Langston Hughes in this area?
Absolutely. Thank you, Eleanor, and good evening to our guests. Let me begin by saying the work that we do in service to our patients and the community is founded on 3 pillars: heal, hire, and invest. Our goal is to promote health equity and engage with partners in efforts to enable lifelong wellness for the community. Health equity means that everyone has a fair and just opportunity to be as healthy as possible with access to things like jobs, quality education, and healthcare. We use a health equity lens to bring healthcare outside the walls of the Cleveland Clinic, like you heard earlier, into the community, as we do with the Langston Hughes Health and Education Center, as well as school-based health. Another way that we bring healthcare and opportunities outside of our walls is through our signature programming, which is youth education leading to workforce development. Our goal is to support students with their overall health and wellness and job readiness through family engagement and career exploration and preparedness as foundations for success in their future careers and in life in general. Our programs include Worldwide Classroom, which is a program for students in grades K through 12, designed to promote healthy choices and healthcare career exploration through connected learning experiences. Worldwide Classroom uses live, webinar-based, and on-demand virtual tools to take health education and career-related learning to the classroom and to students' homes now that we are facing COVID. Our science internship is for high schoolers who attend school and live in Cuyahoga, Lake, Lorain, and Summit County. Science interns come with an interest in clinical careers like becoming a physician, a nurse, a psychologist, working in the clinical lab, and even more opportunities. Interns have gone on to attend college. Others have gone on to medical school, to include our Cleveland Clinic Learner College of Medicine. Also, former interns have even come back to Cleveland Clinic to work, many of whom now serve as mentors to our current science interns. Another program that we offer is the Stokes Internship Program, and that's designed for students who live in Cleveland, East Cleveland, and Warrensville who have an interest in non-clinical roles and the business side of healthcare. One of our Stokes scholars actually spent the summer after his junior year engaging with our CEO and others in leadership rounding and huddles, executive meetings, and also worked on special projects with leaders in our marketing department. You can actually check out the video showcasing this experience by typing in Cleveland Clinic Lewis Stokes Internship 2019 in the YouTube search bar. Another success story is of a Stokes scholar who was hired as a traffic control officer by our Cleveland Clinic Protective Services team after graduating high school. And you can see him around East 93rd Street, oftentimes directing traffic and doing other duties. This scholar is now working at Cleveland Clinic and attending school, bringing him steps closer to his career goal of becoming a police officer. Other scholars have actually been hired by Cleveland Clinic after graduation, and a number of our scholars are currently attending school at 2- or 4-year colleges or universities. Our internships actually serve to sharpen students' soft skills, develop them as leaders in the community and in the workplace, and increase their job readiness skills. Interns have the opportunity to gain real-world experience through projects and other tasks assigned by their mentors. Our goal is to support 100% of our interns with achieving their goals of going on to college and/or employment. Through our internship programs, we traditionally host about 200 students, 9th through 12th grade high schoolers, as paid summer interns. Due to COVID, we're actually hosting a 4-week paid virtual internship this summer with a smaller cohort of students. In addition to programs like Worldwide Classroom and internships, we're also partnering with local school districts like CMSD, Warrensville Heights City School District, and other school districts across our footprint, colleges and universities. We're partnering with Cleveland Clinic department managers as well as our HR team to expand student healthcare career pathways, leading to opportunities for employment at Cleveland Clinic. Our workforce development and job readiness efforts don't end with our students. We also partner with our HR talent acquisition team and community partners to hire individuals from within the local community. As you've heard today, we do see the future of Langston Hughes Health and Education Center not only as your home for healthcare, it will also serve as a community hub for health education, employment workshops, and so much more. So as the director of Central Region, I'm looking forward to hosting meet and greets to connect with our residents as well as our community partners very soon.
Thank you very much, Angela, for giving us that information. And if you go to the Cleveland Clinic website, Angela mentioned one to get the YouTube site so that you can see the Lewis Stokes internship video, but you can also get more information about when registration is available. But I cannot, Angela, let this opportunity go without sharing one of our great success stories, and that is of Dr. Cindy Lewis. A young Cindy Lewis came to us for one of our programs a number of years ago when she was an aspiring PhD student. She was still in undergrad. Once she graduated, before going on to graduate school, she applied for an internship at Cleveland Clinic. She got that internship and then went on to secure her PhD at the University of Rochester. She has worked in many countries, and now we're so proud of the fact that she's working for the World Health Organization and is a critical staff member on the coronavirus project. So you see the Cleveland Clinic footprint is really, for all of our programs, making its way all around the world. Our students do very well. Additionally, we have a strong tuition reimbursement program, and you can learn more about that on our website. And of course, our caregivers get all of the eligibility information once they join us. I thank all of our panelists for telling us about their specific roles and about the future of offerings that will be at Langston Hughes. Now let's get to some of the questions that have been coming in from you, and we'll ask our panelists to address these. So we got this question. Dr. Colleen, we were talking about providers, and someone asked if we could be a little bit more specific. If they get an appointment at Langston Hughes and it's with a doctor or a nurse practitioner, what they're asking is the difference, and should they expect any difference in the level of care?
Sure, good question. So I look at the role with the doctor and the nurse practitioner as essentially a partnership. Typically, the way that patients are distributed between the nurse practitioners and myself is sometimes dictated by just the call center and how you get scheduled. I also often will see my own patients from main campus over at Langston, just because it's actually closer to home and they find it easier. In terms of care, I think that the care delivery is essentially the same. I would say probably the big difference between the doctor and the nurse practitioner or a physician assistant is that typically the doctor is, they have a bit more training based on their residency. And sometimes they also are doing more complex visits. And what I've done in the past when I've worked with nurse practitioners, either downtown here in main campus or at some of my other practices, is that as things start to get stable, I will move visits with a patient in between a nurse practitioner and myself. And if something complex comes up and I need to come in and see the patient while the nurse practitioner is there, they can grab me and we sort of consult at the same time. So I think still the optimal goal is to work as a team for the betterment of the patient.
Thank you very much for stepping us through that. And we know that we'll be in good hands with you, with Shauna, Dr. Takur, and all of your fellow clinicians who are right there working as a team at Langston. We have another question, and Chantel, perhaps you can answer this one for us. What are the days and hours for the outpatient clinic at Langston?
Well, as of right now, I'm sorry, I had to say that. Tuesdays and Thursdays, if I'm correct, Dr. Colleen or Shauna, in the afternoon, I think from 11 to about 5. And then on Thursdays, as early as 8 o'clock until about 5 on Tuesdays and Thursdays. But we do look to expand that to be offering services every day. But right now, we're just building up to that.
Thank you. And do we see children under the age of 18 at Langston Hughes?
At this point, it is strictly adults, so 18 and older.
Okay. All right. So for our viewer who asked that question, continue to stay tuned, because as services may possibly expand in various areas, we certainly will keep you informed. So thank you for your interest in expressing that. We have another question that asked about the scheduling of educational and exercise activities at Langston Hughes. And of course, we know that some things are changing and opening up strategically as more people are vaccinated and things change in the way of the pandemic. Could we address when we might expect to see educational and exercise activities actually on premise?
You want to tag team this with me, Angie?
Sure, I saw you unmuted. You can go ahead.
So I know as far as what the exercise classes are concerned, we're excited to get back to it, but we're really following the guidelines of the Cleveland Clinic and mirroring how we do things with the Walker Center and the other exercise areas. So more to come on that when we're able to open, but as of right now, with the physical activity, it's still on hold. But we do look, as more people get vaccinated and we get the go ahead, we're more excited than whoever asked that question to get that going again.
Absolutely, and what I'll add to that, I concur wholeheartedly with Chantel. I'll add that we are hosting an educational series virtually every month. So every third Thursday of the month, and you'll get more information about that as we send that information out to the community. And those are going to be health focused. And you'll hear more about the upcoming session a little bit later in this webinar. Thank you.
Well, something we know that is being made available right now at Langston Hughes is vaccination against the coronavirus. And we have questions asking about how to get scheduled and when the shots are actually administered. Chantel?
Sure. Yeah, we have them every Monday from 7:30 to 4. And we're asking that if you want to register to call a number that we'll make sure, I'll make sure I put it in the chat. It's 216-448-4117. And you can call any time between Tuesday and Friday from 9 a.m. to 4 p.m. to get a live scheduler. And you can go to that website to learn more information with regards to who we are vaccinating, questions about even other locations if you want to be vaccinated, or if it's one not offered soon enough for you that you can go to another location.
Thank you. That information in that website, handy information to have, because also as things evolve and change throughout the Cleveland Clinic system and how we administer vaccines, you'll stay updated by following that link. So that's good information to hold on to. This question came in advance of tonight's program. And Shauna, if you could please answer this for us. A viewer who's on now wanted to know how they might get information at Langston Hughes about alternative methods to addressing health, such as juicing, steaming, fasting, and raw food diets. Basically, they wanted to know if holistic support was available that does not focus primarily on medicine for well-being.
Yes, at this time, we are able to provide information on prevention and wellness that meet the aspects of holistic health. However, if you need further resources regarding alternatives, then we can refer you to a specialist at main campus. If there's a large interest in the community for alternative methods, then it will be our goal to tailor the services that we offer here at Langston Hughes so that we can become your medical home. Also, in the future, we can certainly have holistic specialists come to Langston Hughes. So yeah, that would be my answer. If that's a large interest of community members, I'll open it up to the other panelists if they have more information or thoughts on this.
Would others like to comment?
Yeah, if I could just add that I think the goal should always be, as doctors, we have no horse in the race in terms of whether or not patients end up on medicines or not. Our goal would be to have people do things with healthy diet and exercise, and in a well-balanced diet should suffice. It's when those avenues don't necessarily get you there that medicines are always something that we can add on. But I think the goal, and certainly my goal as a clinician, is always to act as a doctor but also as a teacher, to see if I can help people get off meds. It's not a foregone conclusion sometimes that you have to be on the medicines that you are on. And if we can do that in conjunction with specialists in some of the education classes that we'll have at Langston, it would be phenomenal. I would love to be out of a job.
And for everybody to focus on well-being and maintaining that. Absolutely. Thank you. Dr. Thakur, we received a question, and perhaps you can answer this for us, and it's about coronavirus and children. And can you please address any updates of which you might be aware for parents who might be concerned, especially as some of the schools, more schools are preparing to go back and open up for classroom learning?
Sure. Many of our schools, they're very careful about following CDC and Ohio Department of Health guidelines for reopening. Some of them had actually consulted with the Cleveland Clinic around their reopening plans. So I would tell parents to feel pretty comfortable sending their children back, knowing that there is a plan in place. If there is an outbreak, there's a protocol. If their child's been exposed, there's a protocol, and parents will receive guidance along the way. As always, we are available for consultations as well. If you're worried that your child has been exposed, if you're worried that your child has developed symptoms, we can do virtual visits. Depending on what your child's symptoms are, we can do visits in the office as well. We can order COVID screening. And for those children that need screening to go back to school, even when they don't have symptoms, we can offer that as well.
Thank you. And that actually segues into another question which we received. And Dr. Colleen, perhaps if you could answer this one, and that is for specific care that might not be available when you are providing primary care at Langston Hughes. Exactly logistically, how does it work in referring that patient throughout the Cleveland Clinic health system for follow-up?
Sure. So, I mean, to take it right from the room to the specialist, what we do as clinicians is we will put the order in, and we're lucky enough that we have a team that can either help schedule those and help the patients navigate through, you know, whether it's on main campus or at another facility. And oftentimes we're also helping patients with phone numbers. We're in the process of working up a way for transportation to come specifically from Langston to main campus if patients need that. There's other sites such as the Stephanie Tubbs Jones site in East Cleveland that have many specialists there. And, you know, we're trying to work out whether or not we can actually get transportation set up for patients between Langston and that site as well. So, you know, it should be sort of a seamless transition. There's always help navigating the system because it can get crazy. And once you get into main campus, it's also, you know, an enormous complex. And so helping patients from our office right to the specialist office, and we have, you know, multiple specialists that we can refer to, it should be something that patients should find easy.
Sounds good. Thank you. At this time, I want to remind our viewers to please continue to go into the Q&A box and add your questions, and we will try to get to as many of them as we can. I'd like to ask each of our panelists to give us a little bit of feedback. As you in your role started sharing with Cleveland Clinic caregivers as well as members of the community and also with patients, what reactions did you get when you said, we have primary care at Langston Hughes? Angela, we'll start with you.
Sure. So feedback that I've gotten is that people are really excited about the opportunity to come into Langston for primary care. We may have mentioned also that there are mammography services that have resumed there. And the community, I've had the opportunity to sit in on some of our virtual calls with community and partners and our residents as well. And they're really excited and they're thankful because they do see Langston really truly as a home, as a hub. And there's a lot of history with the Langston Hughes Community Center. So it's been great feedback.
Chantel?
Well, as you know, I mean, we've always promoted primary care, and we're referring people over to Stephanie Tubbs Jones because it was one of the closest to be able to receive that kind of care. But to be able to offer it right inside the walls of Langston Hughes, it's a great thing. And that was one of the things that a lot of feedback we used to get when we did implement some of those services, mammography services and health education and other kind of screenings. They were very, they trusted what was happening at Langston Hughes and did not want to go anywhere else. So to be able to get everything you need at Langston, from health education, physical activity, you can get your mammogram and see your primary care physician all in the same building. It was very exciting to our partners and to the residents, as Angie stated. They were very excited and grateful that they, you know, they felt like, wow, you know, Cleveland Clinic is doing this for us. They were very grateful.
I know from having spent time at Langston Hughes, clearly in the days prior to the pandemic, and as we were opening up and developing new programs prior to primary care, grateful is certainly the word, and the expressions on the community members' faces, because they feel as if it's their own and they're a part of it. And they're glad that Cleveland Clinic has come to be even more a partner in the community. Dr. Shakur, what are you hearing from even your colleagues when you tell them about what you're doing and when you take out the mobile unit?
Sure. So first of all, regarding Langston Hughes, I think there's a lot of excitement and maybe even some jealousy. I get a lot of questions about how they can get a similar type of center for their communities. So I definitely think that there's a lot of excitement and enthusiasm around Langston Hughes. And then with regards to the mobile unit, we get a lot of requests for us to go to community events, back to school events. Of course, during the pandemic, a lot of that was put on hold, but we're hoping that that will pick up again this summer and fall as the vaccination rate goes up and we're able to have more of those events. And we get a lot of requests to go to various schools to provide the medical services that we do. So we are constantly expanding. I think there's a lot of excitement around that as well, because it does, as I mentioned before, allow parents to maybe stay at work, kids to stay in school for the day. I think it's a wonderful service and a lot of people are seeing value in it.
Great, thank you. Shauna, how about you?
I've received the same feedback. People are very excited to have access to care in a medical home right here in the community where they can have all their needs met, primary care, mammograms. So people are very excited and thankful.
Wonderful. Dr. Colleen.
So I've seen a lot of excitement from patients that I've already started seeing on main campus who will see me over at Langston. It's, I think, important to remember as clinicians that even though the office is comfortable for us, it's not comfortable for patients sometimes, and it's a scary thing. And I think the opportunity that Langston presents is that it's home, and we want people to feel comfortable. And we want people to also provide input for what we can provide to the community and to them as patients, because the idea is that this is maybe a little bit different model than some of the other sites that we have, including main campus. And we want it to be less inclusive. We want it to be something that is sort of iterative and is changing and is adapting to the needs of the community. And we will love feedback. And it's just exciting to see how happy people are to know that the clinic is focusing on them.
Thank you for mentioning feedback. We did get an inquiry from one of our viewers who's asking how to get in touch with leadership at Langston Hughes if, as a partner in the community, they would like to have a dialogue. Angie, which number should they call? Can you please suggest, and we can share that?
Sure. So our mainline number at the Langston Hughes Center is 216-361-1773. And I'll repeat that as 216-361-1773.
Thank you. We also received another inquiry. So Chantel, I'm going to ask you if you would please go over again, and we'll ask our technical director and producer, Tom Miller, to put up the slide for the COVID vaccination information at Langston Hughes, because this viewer expressed that they want to make sure when they register that they get their shot at Langston Hughes. So there's the information there. And Chantel, if you could please review it for us again.
Yes. So yes, please call from 9 to 4 from Tuesday to between Tuesday and Friday. If you call this number 216-448-4117, and you can request to be vaccinated at Langston Hughes, they will get you an appointment.
Thank you. Are there any other thoughts that you as panelists would like to share with our viewers who are made up of community members, potential patients, perhaps some current Cleveland Clinic patients who are considering coming closer to home and seeking care at Langston Hughes, and to caregivers who might be available to serve as ambassadors for Langston Hughes who are watching right now.
I have one comment, Eleanor. While, we are very, very, very excited about the response, I want for the community to understand that they deserve this kind of care, and they deserve care right in their community. That this is for them. And this is based on what we've seen over the years, and wanting to make sure that that happened for them. So I want that, as much as I've seen that, the community and our partners are very gracious along with their caregivers, I want for them to understand that myself and my colleagues and the rest of us on this panel, we think they deserve this, that this is something that they deserve, and we want this for them. So we want them to take advantage of the services that are offered there, along with the wraparound services and the health education that will be resuming soon, along with the gym and the line dancing and Zumba and aerobics and all that good stuff. But we just want for the community, and I know I can speak for those on the panel as well, but they deserve this, and this is what we want them to have.
Well said. We received a question about someone who wants to come to Langston Hughes and ask if we accept Medicaid there. Is someone available to
We
give
do
us an
indeed.
answer?
Yep, we do indeed.
Okay.
Whether it's CareSource or Molina or Buckeye, those are the three, as far as I know, the three main sources of Medicaid that we cover, and Medicare, and just commercial insurance as well.
Dr. Colleen, am I correct in saying that whatever a party might present for payment at any Cleveland Clinic healthcare facility or other healthcare facility is what they should be expected to present and inquire about at Langston Hughes?
Correct. And I think the other part even for patients who are uninsured, we have the ability to work with our social work team to help get them the appropriate coverage so that they can continue to get care. The other part that I will say as sort of a caveat to that is for patients who maybe can't, we are more than happy to help also set people up with some of our other centers, like federally qualified health centers, because we want a partnership. The goal is always, yes, as Cleveland Clinic, we want to help people get better, but that doesn't necessarily always have to come from us. We want people to live the best life one way or the other, and we're working to help people in any way that we can.
Thank you very much for sharing that. And we hope all of our viewers will remember the options that are available for primary care at Langston Hughes. You've heard about them, and the news will continue as we evolve even more there on East 79th Street and are able to provide more services. So we want you to remember that it's a new home for primary care. And we want you to please help spread the word about Langston Hughes, your Langston Hughes outpatient care. The information is there on the screen, and we hope that you will continue to watch for more information in the news, on Cleveland Clinic's websites, and by following up with the numbers that were provided for either COVID vaccinations or for getting in touch directly with the office there by calling 216-361-1773 and the all-important appointments number 216-445-0700 to make an appointment. We truly hope that this evening's forum was interesting and informative for you, and we're pleased that you have listened to what we have to say about Cleveland Clinic and all that Langston Hughes has in store. and are considering making Langston Hughes your home for healthcare and utilizing it not only for primary care services, but for also the other offerings which we've discussed this evening, such as mammography screenings, health education, behavioral health, social work, and patient navigation. And finally, again, you choose to make Langston Hughes Center your home for healthcare, please keep this number in mind for an appointment. That's 216-445-0700 to request an appointment. I want to thank each and every member of our panel tonight, Chantel Wilcox, Dr. Colin Colleen, Dr. Rupa Thakur, Shauna Chesney, and Angela Kane for providing your expertise and talking about the community and health partnerships and Langston Hughes and all it has to offer. To our viewers, at the end of this forum, you will receive a post-event survey. We ask if you would please complete it and return it as soon as possible. And if you have any questions, if you have any concerns that we have not addressed here, you can email us. The email address, chp@ccf.org, chp@ccf.org. We have more community forums and virtual events coming up. So we invite you to join us for future programming that's been scheduled. The next one will be hosted on Thursday, April 15th. It's from 5 to 6:30, and that focus is on digital equity, leveraging MyChart and telehealth appointments. So we hope that you will come back and tune in on April 15th. For now, I thank you all for your engagement, your participation, and your partnership. And we hope you enjoy your evening.